You know that awful burning sensation in your stomach that feels like it'll never go away? That pain that wakes you up in the middle of the night and completely ruins your day? Well, millions of people live with this problem daily. But the good news is, there's a solution. Today, we're going to talk about a subject that affects many people's lives: stomach inflammation. I'll explain clearly and directly everything you need to know: the signs your body gives you, modern investigation methods, and most importantly, effective strategies to solve this problem once and for all. If this content makes sense to you, give it a thumbs up, share it with anyone suffering from this problem, and hit the bell icon so you don't miss future videos. Block 1. Understanding the problem. What actually happens in the stomach? Imagine this. Our stomach has a natural protective layer, like an internal shield. When this shield is compromised, the acid that naturally exists there begins to attack the organ's wall. That's exactly what we call stomach inflammation. This process can manifest in two main ways: sudden manifestation, when it appears suddenly, generally related to specific situations such as excessive alcohol consumption, inappropriate use of certain medications, or even severe traumatic situations. Prolonged manifestation, when the problem persists for months or years, frequently associated with the presence of specific microorganisms or more complex health conditions. Debunking the popular myth. I need to clarify something very important here. There's a widespread belief that more tense or stressed people automatically develop this problem. That's not true. A very calm person can suffer from stomach inflammation, whilst someone quite anxious can have a perfectly healthy stomach. Stress can indeed worsen symptoms in those who already have the problem, but it's not the direct cause. Block 2. Identifying the signs. How does your body warn you? Let's now talk about the main alerts the body sends when there's stomach inflammation. The most characteristic sign, that burning sensation localized in the upper abdomen area just below the chest. To help you visualize better, it's in the so-called pit of the stomach, that central area between the ribs. It has a rather peculiar characteristic. This uncomfortable sensation tends to decrease temporarily when you eat. It's the famous pattern. It bothers you, you eat, it improves for a while. Other important indicators: nighttime awakenings with discomfort in the stomach region, constant sensation of nausea, frequent desire to vomit, feeling your stomach is very full even after eating little, discomfort that varies between tightness, stabbing pains, or even cramps. Distinguishing from common heartburn. Many people confuse them, but it's important to clarify that burning that rises up your chest towards your throat doesn't always indicate stomach inflammation. Frequently, this symptom is related to the return of acidic content to the esophagus, reflux, or inflammation of the esophagus itself. These are related problems, but distinct. Block 3. The most common causes, 4:45 to 6:30. When it appears suddenly. Acute inflammation generally appears when a significant imbalance occurs. The most frequent situations include external factors, excessive and concentrated consumption of alcoholic beverages, use of medications that compromise the stomach's natural protection, especially anti-inflammatories, organic factors, presence of specific bacteria that damage the protective barrier, critical health situations such as severe trauma, extensive burns, or severe systemic infections. When it becomes a chronic problem. In prolonged cases, the main culprit is a bacteria with a complicated name, Helicobacter pylori. It's responsible for the vast majority of cases that persist over time. There are also less frequent causes. Certain autoimmune diseases that affect the stomach, specific inflammatory bowel conditions, continuous and prolonged use of medications aggressive to the mucosa. Block 4. Changes that make a difference. 6:30 to 8:15. Lifestyle adjustments. Here's what depends exclusively on you and can completely transform your quality of life. Eliminate completely. Smoking, no exceptions. Alcoholic beverages, particularly wines, which tend to aggravate greatly. Reduce drastically. Stimulating beverages, traditional coffee, dark teas, black, mate. Fizzy drinks of any kind, energy drinks. Concentrated fatty foods, chocolate, products with coconut, nuts, walnuts, peanuts, cashews, deep-fried foods, pasties, fritters, savories. Very acidic fruits, lemon, acerola, passion fruit, pineapple, kiwi. The impact on quality of life. I'll tell you something I see frequently. It's not just hunger that makes people irritable. Constant stomach pain has an enormous impact on mood and personal relationships. I receive patients at the surgery who are literally brought in by family members tired of constant bad moods. People who live with pockets full of antacids, stopping at pharmacies all the time, with relationships worn down by irritability. I've witnessed cases where, after proper treatment, family members thank me saying I saved the marriage. It's no exaggeration. Chronic pain profoundly affects social and emotional life.
Block 5. Investigation and diagnosis. When and how to investigate. The decision about conducting more detailed examinations depends on the individual clinical picture. It's not always necessary to go straight to invasive procedures. Situations where direct treatment is sufficient. Young patients, classic and well-defined symptoms, no signs of complications. In these cases, we begin a trial treatment and evaluate the response. When we need to investigate further, we request upper digestive endoscopy when there's unexplained weight loss, episodes of intense or frequent vomiting, presence of blood in stools, anemia without apparent cause, associated fever, more advanced age, very intense or atypical symptoms. How does the examination work? Endoscopy is performed with the patient under light sedation. A thin, flexible device with the camera is introduced through the mouth, allowing direct visualization of the stomach's interior. The procedure is painless and allows not only viewing, but also collecting small samples or biopsies for laboratory analysis. These samples are fundamental for identifying that bacteria I mentioned, Helicobacter pylori. Block 6. Effective treatment. The correct therapeutic approach. Modern treatment for stomach inflammation is surprisingly simple in most cases. It generally involves just one specific medication used for the correct period. The most commonly used medications. They belong to a class that drastically reduces stomach acid production. The best-known names include omeprazole, pantoprazole, and lansoprazole. Important warning: although many of these medications are available without prescription, never self-medicate. Inappropriate use can mask more serious problems or create resistance. Furthermore, contrary to what many people think, these medications do not need to be used forever. The doctor will determine the appropriate period for your specific case. Demystifying treatment. This problem isn't a life sentence. With proper professional monitoring, correct medication,